I'm going to introduce our next speaker, Dr. Renata Ivanek, who will be talking about antibiotics in animals moving towards smarter use. She's a professor also at Cornell University within the College of Veterinary Medicine. So thank you, Dr. Ivanek, for joining us this morning.
Well, thank you so much for inviting me. I'm really honored to be not only in this venue, but also the collection of speakers was amazing. And as you will hear, in many things, it seems like we think alike, although we did not coordinate. So as you might be guessing from my title, I'll be talking mostly about cows. But before I start, I wanted to tell you a little bit more about myself, just to give you a sense where my comments and research are coming from. So I'm a veterinarian, epidemiologist, and modeler. As a veterinarian epidemiologist, I work with a number of different species, including the human species, in true to the One Health concept. And in terms of the rest of my domain knowledge, I have had the fortune of working with food animal species all the way from food to table, through farmer, manufacturing, and retail. In terms of my interest, I'm really passionate about the intersection between food and health, about how food impacts health, and oftentimes that's through food safety, but also how health of people might impact food production. And then when it comes to my approach as modeler, I keep three pillars in mind when I do research, and that's what's the data, where the data is coming from, how truthful the data is, or how complete, whether the models that we are using are unbiased, and what kind of models, and then always also keeping in mind the people who are either providing the data or using the models, or what are the overall stakeholders' views about the problems we study. So today I'll talk about two aspects of stewardship. One is on consumer-driven stewardship, and in terms of what stakeholders want, and the other one is on measuring antimicrobial use or antibiotic use to manage it as a prerequisite of data-driven stewardship. And as I mentioned, I will mostly talk about cows. Dairy cows are very important to New York State, where we are, and it's a really good model system to study these problems. So I'll start with a little bit of farming landscape, just to, for anybody who is not familiar with this, just to get everybody on the same plane. And this really well complements what Amelia was saying earlier. So there are two groups of farming systems. One is conventional, the other one is organic. So on conventional farms, like livestock farms, including dairy farms, antibiotics are used, both medically and non-medically important, are used under the supervision of licensed veterinarians for prevention, control, and treatment of diseases. And this is subject to FDA regulations over antimicrobial drugs, including veterinary feed directive that Casey was talking about. And as she mentioned, the veterinary feed directive was put into force in 2017 with the goal of ensuring veterinary oversight and to remove growth promotion claims for medically important antimicrobials. So those are conventional farms. Now, on organic farms, animals can also be treated with antibiotics. However, organic labeling does not allow the sale of food product raised with those animals, including milk. So the organic labeling does not allow the sale of milk from cows ever treated with antibiotics. This is according to USDA organic certification. So what that means that if an animal was treated with an antibiotic, it has to leave the farm, be sold to a non-organic market. And so among some circles, this has raised concerns over animal welfare, because if an animal has a disease and it was not treated with antibiotics, although it's a treatable disease, maybe it was not treated because that would reduce the animal value. So with that introduction, over the years, we have conducted several studies on this question, the premise, can we use less antibiotics in livestock, in food animals? And again, as a model system, we use dairy cows. And we talked to three main stakeholders, the farmers, veterinarians, and consumers. Very broadly speaking, what farmers think. So conventional farmers, they perceive that their antibiotic use is already judicious They cite welfare justification for their continued use, and they feel very strongly that they should be allowed to treat illness in their animals. Talking a little more with them indicates that they could use less antibiotics if there are financial incentives, because at the end of the day, farmers need to a farm needs to have a positive bottom line, and they have to they are thinking about the survival. Veterinarians, on the other hand, the conversation with them pointed out to the need for continuous education on antibiotic use, and this resonates to what both Casey and Dubra was saying earlier, and also Milia. And then talking with veterinarians, they indicated some areas for reduction in use on farms. Probably the most interesting research has been with consumers. Consumers, and all of us are consumers. I'm a consumer, you're a consumer, everybody eats food, and so we all have opinions. In fact, consumers are very, very opinionated. We have strong opinions about everything, including antibiotic use. Oftentimes, we are misinformed. And when it comes to antibiotic use, consumers do not want antibiotics to be used in the production of food animals, or they want those antibiotics to be used less. But some, and in our research, it was about 40%, would approve use to treat illness. So if there is some kind of a compromise across these three stakeholders, it would be, yes, use is okay, but only when needed, which also aligns with stewardship. So thinking about this further, we were thinking, like, what are farmers' primary concerns? So a farmer's primary concern is not overuse of antibiotics, but consumer preferences. So when a farmer gets up in the morning, they're not thinking, oh, wow, I'm overusing antibiotics, I really should use less. They are thinking how they can produce a product that will be well received on the market and help them sustain their business. So we have started thinking, how can we leverage this? And perhaps there is a way to have a compromise between what consumers want and what is important to a farmer. And this comes perhaps from an unusual source. So there is a label in the US, it's called Certified Responsible Antibiotic Use label. Under this label, food is being sold. And under this label, farmers keep records of antibiotic use. Antibiotics of medical importance are used only when needed, and that is when they are prescribed by a veterinarian to treat a diagnosis. It has to be diagnosed bacterial disease or controlled disease post-exposure to infectious bacteria. And this is done under the certification of a third party, which happens to be USDA. So broadly speaking, this label restricts antibiotic use more than conventional farming, but less than organic farming. And this label actually has existed for 10 years in poultry. And since last 2 years, it is also available for swine and beef, but only for institutional sale. Or institutional purchase, meaning that it's not like you and me will not find it in a store, but hospitals, schools could purchase these products. So we ask a question. As I said, these products are available for poultry and pork and for beef. We ask a question, what if there is a responsible antibiotic use milk label? And we did a study. And in the study, we asked 2 questions. So the first one was, if such a label exists, what would be the size of potential market? And this is important because if there is market for such label, then they will provide incentive for farmers to produce milk under this certification. And then the other question was, what is the willingness to pay for such a label beyond the price of conventional milk? And so the first question we answered through a national representative survey. It was a random sample of 1,000 adults, US adults, and we asked them this question. There may soon be a new option in buying dairy milk. This option labels milk produced in a way that minimizes antibiotic use more than conventional milk and maximizes animal welfare more than organic milk. Would you be willing to purchase this type of milk? And this part of the study was run by my research associate at the time, AJ Bullitt. And we then also asked a series of other questions. But at the bottom line, what we found was that nearly 50% of participants, and as I said, all of us are consumers, so nearly 50% of them would purchase such a label, milk produced under this label, the responsible antibiotic use label. And then, so who are those? So most of them also had a self-perception. They perceived that they are aware of antimicrobial resistance problem. They tended to be younger, more educated, and had no conservative ideology. So this is encouraging. It says that if somebody, you ask a random person whether they would be willing to purchase such a label, they would say yes. However, that's not the same as actually opening your purse and paying for such milk. And so it was important to conduct a complementary study to the one that I just explained, where we assess the willingness to pay beyond the price of conventional milk. And to do so, we conducted a randomized, non-hypothetical experimental auction. The study was led by Robert Schell, who was a master's student at the time. And so in this auction was done with real money, real milk, and we used half-a-gallon packages of milk. And we had a conventional milk, organic milk, and we used organic substitute for hypothetical responsible antibiotic use milk because such label obviously doesn't exist yet. And I'll explain how the auction happened in phases. There were three groups, and I'll start by explaining the first one. So in the first group, first we had a practice bid. This was really just to teach participants how do you even go about bidding. And we used bottles of water, just regular water, to teach them how to do it. Then we gave them milk to taste. So they were able to taste each of the three milks. And then we told them, okay, so this milk is, for example, organic. This milk is responsible antibiotic use labeled milk, and this is conventional. And then after we revealed the label, we asked them to auction for it, like how much would they be willing to pay? After that, we gave them educational treatment. And for that educational treatment, we told them about the emergence of antibiotic resistance, that is due to overuse of antibiotics. We told them that organic farms do not use or use very little antibiotics because they cannot market their products in organic market. And then therefore there is this proposed solution, but that raises animal welfare concerns. But then there is also this proposed new solution of responsible antibiotic use label, which had the characteristics I mentioned earlier, where there are careful records held by farmer. Antibiotics are used only for diagnosed diseases, and this is done under certificate. So it is certified by a third party. So after this education treatment, we were asked them to bid again, how much they would be willing to pay now. Then we told them about nutritional value of milk, and there was a third bid. So the second group, with the second group, we did slightly differently. So rather than telling them before first bid what type of milk, what is the name of the milk they are drinking, they just stated, we have them bid for milk just based on taste, and then we revealed a label and provided education treatment at the same time. And as a control group, we never actually gave them educational treatment. So this setup allowed us to compare us within and between to see how much they would be, whether education treatment influences them or whether the label influences them. So here are the results. So on the x-axis, I'm showing the three labels: conventional, responsible antibiotic use, and organic, and then how much they are willing to pay after each information shared. And on the y-axis is willingness to pay in US dollars. So what you can see, and I don't know if you're able to see my mouse, but after the label was revealed, so we told them, so this is conventional, this is responsible antibiotic use, this is organic, their willingness to pay dropped for conventional milk and responsible antibiotic use milk, but it went up for organic. So knowing that they are drinking that the organic milk is one of the milks, that actually increased their willingness to pay. Now, when we provided educational treatment, So we told them about this looming problem of antibiotic resistance and how there might be welfare concerns on organic farms, and how this responsible antibiotic use might be a solution. That actually did not change at all their willingness to pay for conventional milk or organic, but it did improve their willingness to pay for responsible antibiotic use milk. So to put it all together, again, 3 milks, and then on x-axis and on y-axis, willingness to pay for half a gallon milk. And the big dot for the 3 types of milk indicates the mean, the average, and the whiskers indicate the 95% confidence intervals. So we can see compared to conventional milk, for responsible antibiotic use milk, these participants would pay only 6 cents more than only 6 cents more, and that is obviously that was not a significant increase. However, everybody loved organic, and for organic, they would be willing to pay quite a big premium. So the conclusion from this part of the study was that consumers will not pay a significant premium for responsible antibiotic use labeled milk. So to put it all together, for what we learn about this potential approach to stewardship, the consumer-driven stewardship, as I said earlier, stakeholders have opposing perceptions about antibiotic use. And like one way we can leverage that is to, for example, leverage the consumer's power to affect change through their purchasing behavior, but at the same time work with farmers' priorities. So potentially that could have transformative implication, because it would not completely eliminate antibiotic use, it would just make it more responsible. Interestingly, 50% of our study participants would be willing to purchase the new label that we proposed, but they would not pay a significant premium for it. And so what could be the reasons for this result? So it's possible that our survey results were actually biased due to social desirability bias, where participants might say or respond what they think would be socially more desirable. Or it is also possible that there's genuine preference for this kind of milk, and if there are different types of milks in the store, they would go for this type of milk, the responsible antibiotic use label milk, but they would not pay a premium for it. Maybe because they expect that actually any milk should already be produced under the responsible antibiotic use. So that was what I wanted to say about consumer-driven stewardship, and I'm going to switch gears now to data-driven stewardship. And it's really interesting that both Casey and Amelia and I use the same graphic, and I'm going to use it slightly differently. So when we think about antimicrobial resistance, a huge driver of this, obviously, selective pressure is antibiotic use. And so my work is mostly in antimicrobial use and resistance in food animals. The problem is that we really do not have a good understanding, definitely not very, very good quantitative understanding of how use impacts resistance, the causal relationship. Now, why is that? Well, one big reason for that is because we do not measure antibiotic use in animals well. So in the words of Lord Kelvin, who many years ago, he was famous for many things, but one of the things was what he said. So he said, I often say that when you can measure what you are speaking about and express it in numbers, you know something about it. But when you cannot measure it, when you cannot express it in numbers, your knowledge is of a meager and unsatisfactory kind. It may be the beginning of knowledge, but you have scarcely in your thoughts advanced to the state of science, whatever the matter may be. In other words, put it simply, if you cannot measure antibiotic use, there is no way you can improve on it. And so stewardship without knowing how much we use, quantifying it, will not work. So a large portion of our research over years has been dedicated to this question. So how much is actually used in livestock? So speaking of this, in food animals, FDA plays a very important role. So FDA keeps track of antimicrobial sales data for food-producing animals, and they report this annually. This is happening actually in many countries around the world, and FDA does it for US, where we keep track of sales. So what were the sales of antimicrobials for use in food animals, specifically cattle, chicken, swine, and turkeys, and both medically important and non-medically important. And then the reports are in the form of graphs like this, where you have the annual total kilograms overall. Notice that there was this big dip in 2017 because of the veterinary feed directive that was mentioned earlier. And then speaking further of this, again, on the FDA website, there are very nice graphics. So for example, here on the left, the top graph bar chart indicates total biomass, what's the total body mass of animals, food-producing animals in the United States over years for cattle, chicken, swine, and turkey. Then the middle panel of figures, bar graphs, indicates what are the sales on each of those species. As you can see, it's very different across species. And then the third panel importantly adjusts sales for biomass because that provides a more comparable metric. But then this again shows differences. So again, biomass adjustment on antimicrobial sales is done so that we can interpret this data better, because it's a big difference between the body mass of a chicken versus, for example, cows. Speaking of this, we have done an interesting study where we wanted to know how the FDA methodology for biomass adjustment compares biomass adjustments of antimicrobial sales data compares to other countries, specifically European Union method, the method used in Canada, and the method used by the World Organization for Animal Health. So I will not go into details here. So each of the methodologies, so the different components of the equation, the denominator, the animal population, but I want to point out the differences in how each of those four methodologies keep track of the biomass in a given country, and specifically the parameter of animal weight, where the FDA methodology uses the weight of animals at slaughter and also adjusts for average weight for those animals that survive over a year. The European Union and Canadian method use the average age, the weight at the average weight at treatment. So whenever the animal was treated during their life, what was the average age of that? What was the average weight at that time? And then the OIE, or World Organization for Animal Health, uses a similar approach to FDA by taking the weight at slaughter. And this is important because additionally, in addition to different methodologies, the weights that are used in calculation are different across the four methods. And so, for example, if you think about cattle, so the FDA methodology would use a metric of 600 kilograms per cow, while, for example, a European Union method would use 425. The European Union method uses something that's called population correction unit. And if you recall what Amelia was talking about when she referred to a recently published study, that was one of the methodologies used. Another big difference is, for example, is in turkeys. And so big difference between 14 kilos or 6.5 kilos. So if we put this together, on the x-axis, I'm showing the four different methodologies: the FDA, the European Union, the Canada, and OIE. And on the y-axis, I'm showing the unadjusted antimicrobial sales, and then also animal biomass. And so the little white bars are the sales of antimicrobials in 2018 in the United States. And all methodologies use exactly the same data, and therefore this is exactly the same bar. But then things get different with gray bars, which indicate the biomass calculated with different methodologies for the same US population, and then the calculated biomass adjusted sales in black bar then carry that difference further. And so if we would use the FDA methodology, we would interpret this as 65 milligrams per per kilogram, while with the European Union methodology, it would be much more. So if ever want to compare how much the US uses compared to other countries, it's important to be aware what methodologies are used in different countries. And so one safe approach, in addition to the one that Amelia was showing, that used PCU or population correction unit applied to different countries, another safe approach is to use the World Organization for Animal Health, the OIE method, where according to that metric, the US would use about 57 milligrams per kilogram. Global average is about 100. All right, so that was about use of sales data to understand antibiotic use in the United States. But that's really just, the sales data are really just the guess of the drug manufacturers. This data lack the granularity. We don't know, based on that data, what was the reason for treatment, what was the route of administration, what was the dose, how long were antibiotics applied. We don't know anything about the treated animal, what was the age, or what was the production category, was this a young stock or an adult animal, or we know nothing about the context on that farm. Was there a large infection pressure? What was the herd size, and so forth? So the thing is that in US, there is currently no mechanism to aggregate antimicrobial use data at the farm level. So nearly 10 years ago, FDA published a really nice list of requirements that a system for on-farm antimicrobial, for collecting on-farm antimicrobial use data would have to satisfy. So it would have to provide detailed drug use data that accurately reflects the on-farm use, provide baselines so that we can do benchmarking, provide pilot methodologies for collecting, summarizing, and reporting use, fostering public-private partnerships, leveraging existing systems so that the burden and disruption to animal producers is minimized, and also incorporate strategies to protect farmer identity and other confidential information. So a lot is already happening in this space. There are many prominent groups, researchers doing research in this area when it comes to antibiotic use in livestock, but there were still some gaps. One of them would be identified when we started looking into how we can quantify antibiotic use in food animals and specifically in dairy cows. There were 16 different ways you can go about it. And that's a lot. So we did another study. So in this study, we synthesized all these 16 different ways you can go about it. We looked very carefully in their equations. We standardized equations so that you can convert from one metric to another, and you have a good understanding and interpretation what each of them mean. But overall, there were five what we call count-based indicators, where you simplistically count the number of treatments over population size, or population at risk or population treated. The other, there were two metrics, two indicators, two ways to measure antibiotic use that are mass-based, where you divide the drug mass with, I'm just going to check, I think there was a comment, now I cannot see it. All right, so you divide the drug mass and with population, and then there were 9 dose-based indicators where you divide the dose or the number of doses with the population. And dose is calculated in 9 different ways, actually, or the population is not calculated. So this metric, there are 9 different ways to go about it, but the dose typically calculated by taking the total active substance mass, so the mass, divided by the product of some standardized daily dose and multiplied with animal mass. So in these equations, in this simplistic view of these 16 indicators, the numerator and the denominator can reflect the actual use based on individual records. They could represent national or farm standards, or even farm approximations. This is why there are so many of them. I do have slides where each of those 16 is broken down and shown in detail, but in interest of time, not everybody is interested in fine details. I will skip to this over this, and I'll just tell you what else we did with these indicators. So as I said, we standardize them so that we can have a better interpretation and we can use them interchangeably. And then we score them, and we score them based on what is the capacity to capture accurately and with a lot of granularity what is happening on the farm, how much effort is required, are there any privacy concerns, and then if they provide insights about stewardship in a way that they allow trending, looking into trends over time over a population. So here on the right, it's a pretty busy spider plot. The best outcome, best score is the one that is at the outer edge of the circle. This I'm showing 16 indicators, but what I want to point out is here is that we were able to point out to, depending on which criteria we are using, to two count-based indicators that did really well based on privacy and effort. So low effort required and low privacy concerns. And also so both of them are measuring time of duration of treatment. Then one mass-based indicator that measures the mass of antimicrobials over 100 animals at risk. And then in terms of stewardship and accuracy, best indicators were those judge those that are those two dose-based indicators. And so one thing that was noticed was that those indicators that had better accuracy tended to score better in being able to inform stewardship, which kind of makes sense. And then the other one was there was this trade-off between accuracy and effort, and also accuracy and privacy. And this is important because actually, if we are going, obviously our goal is to have capture accurate use, but if it comes at the cost of requiring a lot of effort or have there being privacy concerns, then it's not going to happen. So I'll show you just one other piece of information, and then how that motivated our other work. We approximately simultaneously have done another study. So this was a survey of dairy farms in Northeast US. And we asked them a bunch of questions, what they think about antibiotic use and resistance. Interestingly, 70% of them said they would be interested in knowing how antimicrobial use on their farm compares to other comparable farms. So they are interested in sort of knowing and using as a benchmark. And this was done by Eleni Kasseri, who was a DVM student at the time. So this leads me to the current research, really exciting, with a great group of colleagues. It's funded by FDA to a large, and the idea is to come up with smart antimicrobial or develop a framework for smart antimicrobial use in livestock that's data-driven and that is able to provide actionable insights both for farmers but also at the same time for stewardship. So the group of collaborators have veterinarians, computer scientists, people with expertise in privacy, data automation, and also amazing students. I will share with you just, so this is preliminary, and I'll share with you some of the things we were able to do. Until now, we were very excited about their prospect. So Katrin Kobel, a PhD candidate in my group, has developed this really cool app. It's called Audio, and the Audio stands for Antibiotic Use in Dairy Investigated Online. The way Audio works is that, and I'll share in detail the type of information that go in, but it uses a 3 template input system. So data are in 3 CSV files. They are uploaded, and then a user can see an interface like this, where they can look into each one of the 3 groups of indicators, the mass, dose, and count-based indicators. They can look overall antibiotic use on their farm or specific group like cows only or young stock only, specific diagnosis. They could subset this specific diagnosis and also look into specific antibiotic classes. And the interface provides both tabular data and also graphical representation. Now, very recently, Katrin also developed an output so that results of Audio are presented in a easily accessible format so the farmer can understand what each indicator is telling them and what it means in terms of some practical insights for their farm, either about clinical insights or economics. So I mentioned that I will explain what goes into audio. So there are three buckets of information. The first one is here on the left, the veterinary information in terms of veterinarian's protocols developed for that farm. Then a larger amount of information that's coming from farmer in terms of treatment records on the farm, the number of animals on the farm and how that changes over time, and also what are the entered protocols for treatment. And then a lot of public information in terms of, for example, growth curves for us to be able to, because most farms are not measuring the weight of animals, and we need weight of animals at treatment to be able to calculate some of the indicators. So we use growth charts. Depending on age, we calculate what was the likely weight. And then also drug specifications. What is there available standardized dose, or what are the milligrams used in that dose? And then this is used to create the three templates that I mentioned earlier, uploaded into audio, and then user has summarized many different ways to look into that, like a dashboard looking into their antibiotic use. So this is meant for the farmer or veterinarian or both to use. Now, I don't think I mentioned, but so the first time we did this, it was Katrin who cleaned the data and organized the data into those three templates for use with audio. That was very time intensive, and it's impossible that either farmer or veterinarian would use something like that. So therefore, we have great colleagues in the group who are automating this process. So now we have large language model pipeline that takes raw data and transform into clean data and ready for use with audio. At the same time, we are also conducting interviews with farmers and veterinarians so that we learn which features in audio or in this automated framework, the pipeline, they would like to see, what would be most useful to them. Speaking, and also we are asking farmers about their privacy concerns. And this is important, and it actually leads to another thing that we have done that actually Katrin Kobel has also developed. And so it's a way of augmenting data, the farm data, with simulation. So Katrin developed Mixtape, and Mixtape stands for Modeling Individual Experiences of Treatment with Antibiotic Product Events. So what happens is then when we have data from on a farm, everything from protocols, from treatment, the inventory, how many animals the farm had, we use that to create a computer replica of a farm, like a digital twin of a farm. And then we use this digital twin of a farm to calculate antimicrobial use indicators, basically use audio together with Mixtape. And then we can do all kinds of experiments. We can experiment and say, what if I now use a different protocol for antibiotic use? How would my antibiotic use indicators change? And this is something that obviously it would be much more difficult to do in real life, because obviously it would take effort and time to see, but also some of those experiments might not be ethical just to see what would happen, unless you know that they will be effective. So here is an example of output from Mixtape. We do simulations and then compare simulations output with the actual farm records as part of validation. And then on the right are a number of violin plots. For example, for one of the indicators, that's number of regimens, where we compare the baseline, the top violin plot, compared to different scenarios. So for example, what if I use blanket dry cow therapy, which is different from what I'm doing now? Or what if I do pathogen-based mastitis treatment? Or what if I improve cow health by reducing incidence of infectious diseases? What would that do to my indicator of antimicrobial use? And as the next step, we are going to connect this with different dollar values so that the farmer can also get insight into cost benefit of these changes. Another thing we are doing, so we have a growing data collection on antimicrobial use on dairy farms. But what I'm going to show you next is it's a preview from a really detailed collection from 5 farms over 1 year. So we had detailed records on those 5 farms, the antibiotic inventories, and that resulted in more than 10,000 records of drug use of 15 different drugs on nearly 8,000 animals. And so this kind of data is then used with audio to start quantifying to see how these different indicators work in practice. So this is a preliminary analysis, and this is just to show you how antibiotic use might look like. I'm showing 6 different indicators. The first 3 are count-based, then 2 are mass-based, and 1 is dose-based. And I'm showing in each row represents a different farm. So green indicates lowest in that indicator, and red indicates highest. And what is interesting is that the first 3 farms kind of alternate between these different indicators, depending on which indicator it is. And so what we really need now is to understand what makes one indicator goes up versus go down, and what does that tell us about stewardship on that farm, or what can be improved. And another thing that we can see is that farm 5 did, based on 5 of these 6 indicators, did worse than the other farms. And this was actually expected because this farm had a veterinary feed director for use of antibiotics in feed because they had respiratory disease problems. And it's really good. Really, we are happy about being able, the confirmation that our indicators were able to pick this up. Another view, based on the same preliminary data, how these different farms differ in terms of different antibiotic class they use. So most of them would use a lot of penicillin, but then other antimicrobials, their contribution to overall use differs. And now what we are doing is understanding how farm context or the preference for use influences these results. Again, towards a bigger goal, understanding what is appropriate use and how can we do better. So I will close. This was what we are doing on data-driven stewardship. Data-driven stewardship obviously needs a lot of data, and it requires a lot of good quality data, complete data, accurate data. Sales data are valuable. Sales antibiotic use data are valuable, but they are not sufficient for us to understand the relationship between use and resistance and how we can actually manage antibiotic use in livestock better. So what we really need is animal level monitoring. I've also showed you that there are many different ways to quantify antibiotic use in animals, and there is still a lot of work. So we have potentially delineated the scope of this by identifying those methods, but now more work is needed to understand how context on the farm, the infectious disease pressure, or the farm size, or the composition of the herd, or the preference of the veterinarian or farmer impacts, so that we can start using those indicators for benchmarking. The other one is, it's super important to automate data collection and using these kind of indicators and provide privacy protection. So when I mentioned mixtape, what I didn't say is that one way a farmer can use mixtape is if they worry about their antimicrobial use data being used directly, what they could use is to what they could do is to use the digital twin of their farm to track and share that data. Or we can use the synthetic data to augment data on smaller farms or more recent younger farm, and similar. But privacy protection is super important, and there will be more research in that area. And then finally, to incentivize farmers' participation in any system that keeps track of animal level antibiotic use, has to demonstrate economic and clinical value to farmer. And if that's the case, if there is a value, then there will be more incentives to participate. I'll just acknowledge many different sources of funding and many collaborators and my amazing lab, and I will finish.
Thank you for that presentation. That was wonderful and admittedly quite out of my wheelhouse, but I appreciate getting to learn about it. And so I apologize if this question is a little bit basic, but are these antibiotic use indicators available at the public national level, or is this research that your lab is doing at this point?
Yeah, that's a great question. No, it's not a basic question. Actually, it's a super important question. So the sales data and the biomass adjusted sales data, that's available at the national level. But for everything else, you really need those records at the farm level. And not just farm, you need at the individual animal level. And that, I mean, occasionally you might have a research effort, you might have a very good farm where you have those records only available. But to our knowledge, indicators are not in use. And in those instances when they are used, they're actually quite difficult to interpret. And so that also limits their wider use. So interestingly, we have developing this for dairy cows, but we had interesting conversation with swine industry. Maybe that will be of interest. Very recently, we had a conversation with equine veterinarian who said, "Wow, this is amazing. Can we translate this for equine practices?"
Yeah, and just to kind of expand on that a little bit, in human medicine, we report the antimicrobial use to the National Healthcare Safety Network through the CDC. So, what organization would that be for these agricultural food animals who would perhaps take ownership if that were to occur?
Oh, that's a fantastic question. To my knowledge, at the moment, apart from sales data that are reported by manufacturers, uh, this kind of data that we are collecting, there is no system yet. So one of our goals is actually to create a prototype of that system.
Thank you. And sorry about that. There's been a conversation going in the chat that I want to bring
Oh,
you into. And
sure.
so it essentially has to do with what can we do in the public health arena to help promote One Health and overcome existing silos. There's been discussions around education, mandatory. How can we make this multidisciplinary? Do you have some thoughts there that you can share with us?
Oh, okay. So there are several, and probably my talks will not be very organized because there are so many ideas. So one thing we learn a lot by doing research with different stakeholders, and then I think more research like this, it's good because then you have to understand the counter opinion to be able to see whether things will be implemented or not. Another thing, I had a pleasure recently. I think it was through NIA, National Institute for Animal Agriculture. There was a webinar where there were participants from human medicine. And it was amazing to have that conversation, veterinarians and I mean, in veterinary medicine, there are those who treat pets and those who treat livestock, and then also have counterpart with human medicine. It was amazing. There are so many problems we have that cast across. There are some that are specific, but then it's much easier to understand how big this problem is, what solution might be if we start talking. And another thing, what was really clearly and very well articulated by Casey and Amelia, when it comes to pets, many of us have pets. And so that it's more relevant to people than you would think on the surface. On another thing, like livestock, all of us eat. I mean, maybe we have different diets, but we all eat. And these topics, again, are very relevant. So like whether you are a patient as a human or whether you own a pet or you eat food, these topics are super relevant to everybody. Maybe that's why we have such strong opinions too.
Yeah, completely agree. And thank you for your thoughts on that.